guys, so welcome. This is Prairie Circle Chat, and we're talking about understanding chest and breast lymphedema today. We bring our incredible Prairie Circle together for education and to share these lovely humans and their amazing knowledge with you that we have the privilege of sharing with them every day. So we have today with us Dr. Alex Hill and Dr. Elise Cantu. They are incredible humans, and I can't say incredible too many times today. I may say it again. I'm already going to pre-warn you. And we'll start with some super quick introductions. My name is Holli Markwald. I'm the CEO here at Prairie. And Elise, take it away.
Hi there, my name is Elise Cantu. I'm a physical therapist here in Fort Worth, Texas, and I specialize in helping people reclaim their health and wellness after a cancer diagnosis. And I think Prairie has been one of my cheerleaders from day one, so it's so exciting to get get back and be the cheerleader for Prairie, because I can't say enough good things about Prairie, like Holli was saying previously.
Oh, thank you for that. Thanks.
And I'm Alex. I'm a physical therapist. I'm in Jacksonville, Florida. I specialize in pelvic health, oncology, and lymphedema. And I love closing the gap on areas that we as providers are missing, but also areas that patients are missing, one of them being chest and breast lymphedema. So like Elise said, super duper stoked to be on tonight talking all about Prairie Wear and breast and chest lymphedema. I'm just super excited.
Awesome. And one of the things that neither of these two humans shared with you just a moment ago is they have incredible Instagram and YouTube opportunities for you to learn more and to reach out. So they'll be linked in our post. And I'm going to call out on Alex. I love your pinned post on Start Here. So if you have any questions about what Alex could do, seriously, it's really helpful. And I think if someone is trying to navigate, how do I find information and what do you do? You've really encapsulated that in a great way. So start there on the Start Here post, and that'll kind of take you to all the resources that Alex offers. And it's not just for medical professionals, it's also for someone that's just trying to find better information for their personal health, which is super cool. So I want to put that out there. And Elise, I have to give a call out two things: the Oncological Rehab, a pocket guide, Oncology Rehab pocket guide.
Thank you.
Yes.
It's amazing. I have it on my bookshelf.
You know what? I actually saw your Insta story where you were like, I got my pocket guide. Yeah.
It's so handy.
And I think it really talks about how important educating our community is and having opportunities to share that education. So I feel you can talk a little bit about this towards the end, but I feel like we always get talking and then these really important resources, we forget to mention them. Right. And so I wanted to put that out right in the very beginning. So two amazing resources in these two wonderful human beings. So please check out their links. And yeah, and one more shout out on Elise. I wrote it down so I wouldn't forget the Cancer Rehab Conference for this year, 2024. Mm-hmm.
Oh,
so yeah, super cool. But let's jump into it. I wanted to make sure everybody had the resources for medical professionals, but also for patients or people who want to understand their health. And Alex, I have to say for myself, I love it just for you on pelvic health, amazing. Just to learn a little bit more and demystify those, even terminology. It's just in such a wonderful way that you share that it's like, oh, you don't have to be embarrassed. You just can listen and learn, which is so cool.
Thank you.
Yeah.
Biggest cheerleader. You're the best, Holli.
I really think you guys are amazing at what you do and how you share education. So that's why you're here, but also it's why I check out your stuff. Like, hey, what are you guys up to? What are they talking about? Like, how can I learn? And what can I share with other people? So super cool. So today we've been talking about this topic a lot in terms of what causes lymphedema, right? And the reason we go over some questions more than others is we get that question a lot. Mm-hmm. And specific to what causes chest breast lymphedema and how is this lymphedema different from other types, maybe either Elise or Alex, whichever question you want to take and jump in.
Elise, you can start us off, girl.
Yeah, so I think we kind of have to boil down. And first of all, Holly, I really appreciate you starting with this question because I'm
Mhm.
sure I can't speak for Alex, but the amount of times that I get this every day in when I'm in clinic with patients, because that's such a common question that people get because oftentimes they don't get the answer or know that they need the answer until it's like months or even years down the road after they've already, like already been dealing with this. So, lymphedema is caused by some kind of overload to the lymphatic system where the lymphatic system cannot keep up with the amount of things that it has to process, right? And I love this analogy of the lymphatic system is kind of like the garbage disposal of our body. It comes in the garbage trucks and it picks up the waste and then it takes it away and then our body gets rid of it. And sometimes that process doesn't work like it's supposed to because maybe there's been damage or injury to the lymphatic system. Like with a lot of my patients, I see a lot of patients after they've gone through breast cancer and breast cancer treatment. And so maybe that was surgery. There was a removal of lymph nodes. Maybe that radiation therapy actually damaged the lymphatic vessels in that area, right? So there's a number of reasons why a person could develop lymphedema in my world, but that's kind of what I start with my patients. Alex, take it away, girlfriend.
Yeah, no, completely agree. Some other things that I've seen in the research and just in the clinic as well are, injuries in terms of damage to the tissue from a cellulitis infection. So like a skin infection
Yeah.
that can contribute to lymphedema. A lot of times with breast and chest lymphedema, rightfully so, we focus a lot on breast cancer survivors, but there can also be the risk with melanoma cancer as well. Or anytime there's radiation to the chest, anytime lymph nodes are sampled from the axillary area, where those are removed to check for other cancers, those are other cancers that can be at risk, but just, again, rightfully so, because of just the pure number and prevalence of breast cancer survivors, we see it much more common with them. But those are some other things that I would bring up as well.
What are some of the most common questions that you receive from patients in regard to chest and breast lymphedema?
For me, I think the biggest thing is like, can this be cured? And I think we get that question across the board, regardless of where lymphedema is. And as we know, unfortunately, there's no cure for it. It's really trying to catch it early, trying to manage it the best we can with things like manual lymphatic drainage, pneumatic compression, adequate compression bras that are working the way that they should work. I think that's probably the number one question that I get.
Mm-hmm.
Okay.
And then I think the follow-up question to that, because usually a lot of patients are maybe more familiar with arm lymphedema,
Sure.
arm swelling and whatnot, and they may know in some cases that, oh, compression sleeve for that. And so if that's kind of where their mind goes, they're like, but wait, is there a compression sleeve for my chest?
Right.
Like, well, no, there's different options. That's what we're going to talk about
Yeah.
here, right? So I think that's probably number one is the question that Alex already answered, but then sometimes you can kind of follow the wheels and they're like, but wait, what do we do for this specifically?
And that kind of leads into the next question that we get most often, although we always refer people to talk to their medical professionals. What are some tips for managing lymphedema, or what are the most common 3 things that you would recommend for lymphedema management, other than work with your medical professional, because that's number 1 and understood.
Yeah.
Right. I think to go back and call back what Alex already said is to catch it early. And I think this is where, like ideally if we can catch it before it gets to, where we're even symptomatic or anything, like obviously that would be great. But right now I'm in Texas, and it is about to get very, very hot in Texas. And so that's one of the things that I'm really starting to like cue my patients on right now is summer is coming. It's going to get very hot. The likelihood that you could experience some swelling if you're at risk or you know that this is already an issue for you is very, very high. And so that's one of the things I like to start with is what are we looking for? what are those early signs and symptoms of maybe, hey, we do have some lymphedema that's rearing its head right now, what to do now,
Mm-hmm.
right? Call me, or, what are those steps we need to take to make sure that we can get you in and get treatment started right away?
Mm-hmm.
Yeah, completely agree. It is actually already hot here in Florida. We hit, I think, 86 or 87 today. So
we hit
I'm
89.
like, what is
Yes.
happening right now? It's too early. But I literally had those exact conversations this week of, hey, like, you might be feeling your swelling more because it's hot out. Where, if you get sausage fingers, right, because of the swelling, it's gonna be elsewhere too. So I definitely talk about that. For me, in terms of, like, especially the breast and chest lymphedema, is making sure that you use the right compression.
Mm-hmm.
Because I have a lot of people that are told, or, they just try to use just like a sports bra.
Yeah.
Or like a bra that is a size too small. Cause, thinking wise, like, if it's small, it's giving more compression. But
Right.
unfortunately, a lot of these sports bras or bras, my band right now is this big. If I have swelling across the chest and the breast, that's not doing anything.
Mm-hmm.
So it's making sure you have the right compression, whether it's compression sleeve and glove, compression glove, sleeve, bra, like whatever compression you need to make sure that it's medical grade or that it's the appropriate fit for you.
Mm-hmm.
Mm-hmm. And there are lots of certified fitters, there's oncological PTs, there's a lot of people that can help you really identify what's the right compression for you. And there's a lot of great products out there. Obviously, we make huggers, which we think are awesome, but there are so many great products. Yeah, we love them too. But I'm 100% biased. But there are really great products out there, and our last circle chat was all about the LTA. So there's also, for those of you in the United States, there's a lot of opportunity now for insurance coverage of compression garments, which is amazing.
Mm-hmm.
And so that's another reason to touch base with a medical professional or someone who can walk you through how to get compression garments, because there could be coverage for you. And most importantly, I think there can be an opportunity to really thrive and feel better. So I was going to share a story that we had in our last circle chat, but I'm just going to leave that cliffhanger and say you can watch it because it was a really good one. Yeah. So I think we covered what are some tips and management. I think the other thing that I love with the two of you is you're always reading and learning and meeting with colleagues. I think you both went to the APT CSM this year. What are some of the latest things that you've learned about lymphedema treatment itself, or anything that you were like, whoa, that was the coolest?
That's a tough
No
one.
pressure.
I feel like I know there's always something new. I think for me, what's really exciting with lymphedema management are the surgeries. Because historically, like, there wasn't anything to do besides complete decongestive therapy of compression, exercise, manual lymphatic drainage, skincare. But now we have the option of at least considering a surgery where they may do a lymph node transfer or connect veins and lymphatic vessels to improve the flow. Even with breast cancer survivors, they're even doing that during the surgery, kind of preemptively, to try to prevent lymphedema, which is really new and really exciting. I haven't seen as much research on specifically breast or chest lymphedema. It's more looking at arm lymphedema, but part of that, a whole other story in terms of like actual diagnosis. I think this is severely underdiagnosed of lymphedema in the breast and chest. But for me, I think the surgical options are really exciting. A lot of people are able to get out of compression or only needing to wear a lighter compression for long-term management instead of some of these heavy duty compressions and wrapping and all that kind of stuff.
I love so much of what Alex already said, and I'm trying not to like copy, obviously, but it is really exciting to see. One of the things, and this isn't even, I think what's cool about this in particular is like breast and chest and then upper quadrant lymphedema are driving some of the updates we're starting to see when it comes to pelvic cancer management, and like starting to more seriously consider like sentinel lymph node
Yep.
biopsies versus doing an entire inguinal lymph node dissection, which I know is not specific to like the chest and breast, but it's cool how because this is so much of what we talk about when it comes to cancer related lymphedema so many times. There's a lot happening in other places, and so it's cool to see that
Mhm.
driving. I would say if we have to stick purely with chest and breast lymphedema, I went to CSM, saw Alex. It was amazing. There's a lot
Our
of
reunions are always
conversation. Oh
hysterical.
my God, love it. There's a lot more conversation happening in therapy world around trauma-informed care and whatnot. And
Mm.
so that's something that I'm personally looking more into. And then how can I really marry that? Because one of the things that was put so beautifully by another fellow physical therapist, Adam Matichak, was,
Mm.
receiving a diagnosis like this is a trauma in itself. I mean, our patients a
Mm.
lot of times are already dealing with complex medical issues, and then they get hit over the head with, oh, by the way, you also have a chronic condition that doesn't have a cure, and you have to
Mhm.
wear compression garments and all these different things. That's a trauma in itself. And I, as the physical therapist treating that person, need to be much more well versed in that. So
Yeah.
that's an area of research that I'm diving into that is really going to help inform how I just better show up for my patients,
Mm-hmm.
frankly.
Mhm.
Mm-hmm.
I think for myself, because this is still all very new to me, I had never heard of lymphedema before working with our breast cancer survivor patients and the diagnosis of lymphedema, and then
Mm-hmm.
really creating garments that work with our post-surgical and lymphedema patients. I hadn't heard about it. I didn't know that there were millions of people living with lymphedema. I didn't understand the lymphatic system. I don't know that I'd even heard the term, quite honestly. And so for me, the latest thing I've learned is people want to learn.
Yeah.
How cool is that?
Yeah.
Yeah.
Like for the first time,
Yeah.
it's coming up in just conversation. And we had someone on our circle chat that she lived with an undiagnosed um, chest and breast lymphedema, undiagnosed chest and breast lymphedema for 10 years. And it was very
Mm.
painful and what's
Wow.
happening. And then once the exercise, the compression, the right medical professional stepped in, it's like the pain went away for the first time in 10 years. Right. So
Mm.
I'm most excited about that for
Yeah.
me personally, that we finally have this opening up of what is lymphedema and how do you get information about it. And I feel like that's still new and it's evolving. When we first did our circle chats, it was really a small field of people. And I feel like it's getting bigger and bigger and the circle is increasing, which is exciting. And to me, that's probably the most exciting thing.
Yeah.
Um, and it's such a supportive community. So
Yes, it
I I do love that, and no pun intended.
is.
I really did. Yeah, it's it really wasn't. So at the CSM, I'm sure you saw lots of cool humans. What's another thing that maybe floated up that we can share with our people here today? And again, for resources, guys, you can put your questions in the chat. We rarely get to answering them in the chat, but we always answer them after, and we'll make sure that we put the resources that we talk about in the actual post. But what's something else we can share with our people today? I feel like I have been talking too much.
Not at all. You can never talk too much.
Yay.
Oh gosh, there are so many good talks, and it's hard because there's 3 sessions per day, if you're not familiar with this conference,
Mm-hmm.
over 3 days. But we have what, 18 plus academies,
I think so.
and each of them have their own sessions. So you're having to split your time between what ones you're going to. So I know one that I went to was about building a cancer rehab kind of program within a center. And that I think is really cool because historically, a lot of cancer centers just needed like a touch point for rehab. And it was that rehab was thought of as more of like an afterthought, or just like, okay, go there, like just in case you need it.
Mm-hmm.
Versus now, like, they're required to have rehab integrated into the cancer center. And so this particular talk was talking about how they implemented it, how they collaborated with the physicians, with the oncology teams. And
Mm-hmm.
so it's amazing to see. I've been a therapist for 10 years, and just in that 10 years, the growth that we've had, but also the respect that we're gaining as a profession.
Mm-hmm.
From other medical providers, and seeing, like you said, Holly, more people that are understanding what our role is and that they can do things about their symptoms that they're experiencing from their cancer treatment.
Mm-hmm.
Mm-hmm.
Was that Tara Newberry
Mm-hmm.
and her team? Yeah, I
Right.
love that.
Yeah.
I do. I mean, that's a passion. And that is really getting the entire community together of all the medical professionals, but also the supporting team members.
Mm-hmm.
So there's another passionate human
Mm-hmm.
about
Yes.
bringing people together in education.
Yep.
That's super cool.
Yep.
Neat. Elise.
So mine is actually not oncology related,
Oh.
but I see how I can fold it into oncology and lymphedema very, very easily. So I went to a session that was all about basically like within the environment that we as humans live in, how can we curate more opportunities to be more of a physically active society? And so it
Mm-hmm.
was so cool. The
Yes.
speakers, which of course I can't think of now that I'm put on the spot, were so amazing. Like they
Yeah.
had such a vision for this, and it came to absolutely like more than what I ever could expected. But they broke it down. They broke us into groups of like, if you live in an urban area, you're in this group. If you live
Mm-hmm.
in a suburban area, you're in this group. If you live in a rural area, you're in this group. And so we got together in our different kind of like, types of communities we live in, and we brainstormed what are obstacles that our patients and us are facing to be more active in our
Mm.
communities. And I mean, even just right away, it was like lack of sidewalks, lack of
Mm-hmm.
lighting for when, we are walking outside, all these different things that just, you see them as you walk down the street, but until someone actually calls it out to your mind, you're like, oh my God, whoa. And so calling out those barriers, but then also challenging us on what are some solutions to that. And so that was a session that I
Nice.
really
Mm-hmm.
took away from and thought, I can bring this back to my own community with my own patients. Because again, what Holly has alluded to and what we've talked about countless times on these circle chats are, we talk about compression. Exercise is absolutely one of those core components of lymphedema management. And we have to
Mm-hmm.
make sure that our patients are able to access that. And so what does it look like for our patients to actually access opportunities to be physically active in our communities? And how can we as physical therapists, not just in the clinic, but also in the community, how can we get out there and make more of an opportunity so that it's easier for our patients to do this? Our patients are
Yeah.
already dealing with a whole bunch of other stuff.
Mm-hmm.
Let's not let all these other things be a barrier to them living their best, healthiest life as much as possible. So
Mm-hmm.
that was, for me, such a powerful experience that didn't plan to go to, but it ended up being one of my favorite sessions at the conference.
Nice. I love that. I love when it brings a different perspective to something that you know, but you don't know
Yeah.
it until you can
Oh my
feel
God.
it sometimes in your heart.
Yeah.
And so I love those moments. That's really great. And I had a chance to meet Tara at Power 2024. I did actually go to a conference this year. I know that I never get to leave the office anymore, but I did go this year. And it was great. And it was just that reigniting my passion for what we do and all the amazing humans that are behind the science of why we do what we do and how we can do it better.
That's awesome.
So that part was really inspiring. And I think that's why I kind of started this with a focus on here's two people of incredible resource. So if you're looking for information for yourself or for a patient, here's two incredible humans with great resources, and they have a really lovely way of tying into the community. I think you both reference other people in the community as more than you reference yourself and your own work. There and check it out so that you can really educate yourself for yourself or your patients. please do so. I think these are people that put their heart out there with the education every day. And as you've just learned, they stay educated. I'm really proud of our physical therapists that are out there attending conferences and getting educated and meeting colleagues and meeting online and creating podcasts so that we can talk about topics. It's really incredible. So check these guys out. And I know we kind of went a little bit off topic today in terms of breast and chest lymphedema. I feel like we covered the topic, but I've also really wanted to tie into what I feel is the greatest resource here right now, which is these two humans and their big hearts and big brains. So
You
yeah.
are so kind. This
Yeah.
is, I've been really looking forward to this because I know Elise very well. If you're not familiar, then she does have a podcast as well, the Onco PT podcast. If you're a clinician, especially, like, definitely give it a listen. I actually listened to it when I was studying for my boards to get board certified in oncology. So a lot of great resources there. But like you said, Holli, we're really a community that uplifts each other, because at the end of the day, it is for these survivors and thrivers. Like, it is to improve their life during and after cancer. And that's, you know, that's it at the end of the day. And anything that we can do to reach that mission, we do. So it's, like you said, it's a phenomenal community that we have in cancer rehab and rehab in
Awesome.
And I think cancer rehab, of all the communities I've been a part of, we know that when we help your patient, when we help my patient get better, we're helping all patients get better, because we don't hold that knowledge close to our chest. We share that with each other. And I think that's one of my favorite parts about this, and just this, you know, folding in Prairie on top of all of this, is like, there's such a sharing of information that if I don't have the answer, I know exactly who I can go to get the answer. And that is what is my favorite part of being a part of this community.
Awesome. I feel like that's our encapsulation of this entire one. So this is a community of support. It's a community of education and sharing and uplifting and helping our patients feel better and helping ourselves feel better, because I feel like we really all benefit from helping others. So awesome.
We're also a big community
guys.
of huggers, also no pun intended, but like, we hug a lot.
Hug a lot.
Yes.
We hug a lot.
Hugs are great.
They really are.
Yeah.
They're so underrated. Like, I love a good high five, like the good sound, but like a hug, ooh, that'll last you.
Something.
All right, guys. Well, until next time, thank you so much for sharing your time with us tonight. And again, we'll have the links and resources in our post. And thank you, everyone. Appreciate your time.
Absolutely.
Thank you, Holli.
Thank you so much.
Bye. Thanks, guys.